Or it's a good strategy to work against.
Ooh. Is it getting better?
Yep. That's better.
So you stretch before you treat?
No, he said his foot was Charlie horse.
Yeah, but-
So, thanks to the
Okay.
law of reciprocal inhibition, I contracted the opposing muscle group. Two opposing groups can't contract at the same time. So I stretched it out. All right. Athlete tests. Knee on top of hamstrings. I should have dropped it. When you're like, I'll be demo. Should have dropped it. First one I'm going to do is compression. So I'm going to put his foot in neutral, and I'm going to push down into the table. From there, I'm going to medially and laterally, lateral, rotate. Are you experiencing any discomfort or pain?
No.
And what are we testing for with these? The meniscus, yes, compression. Next one would be the distraction. So 5 stays the same. This time I'm going to lift. And make sure you get above the ankle joint because you'll kind of just separate these and it can throw you off your results. How's that? Any issues?
Nope, I don't think so.
Nope. No searing pain?
Nope.
His collateral ligaments are good. So compression, distraction. Distraction is collateral ligaments. Compression is meniscus. But he's good. All right, now I have to flip over.
So were you just testing for pain?
Testing for tears.
But he would experience pain when
Yep,
you did that?
that would be like positive signal.
Okay.
Yeah, I don't want to cause him pain, but.
Yeah.
Can I give him a bolster? I can. Because this position, his knees are extended, so his quads are actually contracted. So absolutely, we can give him a bolster. How's that?
That's good.
¿Está bien? Awesome sauce. What's my muscle test going to be? Extension of the knee. So we'll do a casual drape right now. So above the knee or below the knee? Below. Can you extend your knee for me? Look at that. Medialis, lateralis. You can even see rectus femoris here. Push real hard. Look at that. And relax. Is that okay?
Mm-hmm.
Everybody get to see it? I'll make them do it again.
One more time. We're good.
Oh. That's a pretty good looking rectus femoris.
You guys can see it, right? Relax. Good job.
A little bit.
Look, that's why you wanted to be a demo. You're like,
Check out these quads.
I mean, good on you. You worked hard for those, I bet.
Oh yeah.
So what are we draping to? The ACES. Find it back of your hand right there. Sartorius attaches there. TFL attaches there. Rectus femoris just below on the AIIS. How are we going to start our treatment? Our myofascial release? Insert compression. Do a little skin rolling too.
Okay.
Say something if it's uncomfortable.
Mm-hmm.
Shot real loud.
Noise is still loud.
Remember, this is going to be abbreviated, so. Feeling crunchies. Do you feel the crunchies?
Not really helpful.
And now that jingles in my head. So I would just keep doing the skin rolling. Along the IT band, I can do some chucking. That. One class called it shotgunning. I don't know why this was shotgunning. I'm like, alright. Just up that IT band. And the direction, the pressure is going that way. It's not compressive. And I'm just running my hand up. I'm pulling it away from its insertion point. I could do pincher. If I wanted to, I could just hold. Be mindful, though, about holding medial thigh. There's an endangerment site here. We're going to learn next week. It's a little hard to do pincer as we travel up. So instead, just like with hamstrings, that twerking, not twerking. When you do your feedback, this is not twerking.
Can you twerk while you twerk? Sorry, I had to.
I
I had to ask.
I was totally doing it wrong.
All the while, you can assess the tissue and see where your trigger points, adhesions might be. I'm doing some skin rolling, but I'm using the weight of his leg, so I'm like also pushing while I skin roll and letting it come back to do it almost like a jostle to help free it up. These, like the glutes, are going to take a lot of MFR. I would keep going, but for demo's sake, we're going to move on. I spend a lot more time here. I need my butter.
It's probably right in front of me. Where is it?
A little plastic cup and a little white thing. I have Brian on my hands. Will you give me a scoop? A smidgen more.
You said hand below the knee, right?
For muscle testing?
Muscle testing.
Just look it up. I thought you was going to do it. I was like, no. But also, I liked the power that gave me. Do it. Remember, take it all the way up. Oh, that was a perfect amount of butter. Just doing some deep effleurage, and you notice how my hand placement is wide. Keeping it broad. I don't want to flip any muscles. Finding the edges of rectus femoris. I'm running just along though. Prepping it to displace. I'm not displacing it just yet. Treat stuff along the way. Look at that, didn't have to ask it. Can I put an elbow here? On Brian I would. I think on Brian I would. On me, no. On you ladies, nah. Kind of depends on your client. So we can see. There's one right here. Can I try an elbow on you?
Yeah. I can tell I'm not gonna love it.
How's that?
That's good.
I'm not doing a lot of pressure at all. but I want to save my thumbs because clearly he's got thick quads. And I do need it to get to that trigger point, which was kind of either on the edge of rectus femoris or in intermedius on the lateral side. Exactly, it was right there on the border. I wanted something more refined than just doing a fist. Also, yeah, you see that face? He didn't like that. That's not very comfy. Quads don't like a lot of pressure. Hamstrings, you can just power down. Quads, not so much. Now you can use your fist for effleurage. Doing all right there?
Yeah.
Yeah. Fist is okay for effleurage. I wouldn't really use it for trigger point compression. Keep working the lateral edge of rectus femoris. Now we're going to do the medial edge. Same thing. I don't know if I'd want to put an elbow on the medial side. Let's see what happens. All right. Yeah, we're okay. You're more than welcome to try it on whoever your partner is. Go slow and be mindful, be light. You do not have to crank on it like you can with hamstrings, glutes, and even back. These are big, thick muscles. They can take a while to lighten up. And just keep going. With your effleurage. I'm over on medialis now. That big teardrop shape over here.
So what's your effleurage is what would cause us to flip the muscle in a way that we would do?
His muscle would be tight. And so I haven't encountered a moment where it's going to flip. It's common, but it's not always going to happen. You'll feel it. You'll feel like something start to build up in front of your fingers, and then you'll just whoop, right over top of it. So in that instance, if I felt it, I would try and catch it and go with the fibers, almost like zigzag around it. If I felt it start to happen. So in this instance, if I was on the lateral edge of rectus femoris, I feel it start to build up. If I pressed in hard, I might make it flip. The bulk of it is displaced that way. It would flip back to want to be where it normally rests. So I would just kind of back off a little bit from displacing it. Just take some practice. You're not going to hurt anybody if you do it. It'll be uncomfortable, but you're not going to hurt them. Continue with your effleurages. Medial, treat what you find. Rectus femoris, back on top, treat what you find. Now big old lateralis and that IT band. That's going to take a lot of effleurage. Excuse me, sir. Come on me. You can get low, and I'm using my forearm, not my elbow. All right?
Mm-hmm.
All the way up to that iliac crest. Because remember, TFL is up here. If your knees are up to it and the table's low enough, you can kneel. Take a leg out to the side. And I'm just, with my right hand, I'm just stabilizing. I'm not doing a lot of pressure. I'm just keeping his leg from rolling. As I find things, however, I found things. I can use my hands. Using my outside hand, I can. Ooh, doing all right?
Mm-hmm.
This whole muscle tensed up when I pushed in. I came at it, stacked thumbs. I just kind of sat. And when I sat, I pushed forward.
Backed off a little.
Elbow might be kind of tricky.